Thank you for the kind introduction, Dr. Reddy, and hello, everyone. Bonjour à toutes et à tous. My name is Dr. Theresa Tam, and I am Canada's Chief Public Health Officer. It is a pleasure to have this opportunity to share a few words with you. Today, I'm joining you from Ottawa, the capital of Canada. I would like to acknowledge that I'm speaking to you from the traditional unceded territory of the Algonquin and Anishinaabe peoples. On behalf of the Canadian Field Epidemiology Program, and as the country co-host for this event, I would like to extend a warm welcome to all the Field Epidemiology Training Program participants who are joining from across the Americas region. We are privileged to have current trainees, program graduates, and resident advisors, as well as other public health professionals who are joining us as participants, keynote speakers, or mentors throughout the event. I would also like to extend my gratitude to TEPHINET and all of the conference organizers for making this event possible. Epidemiology is part of the foundation of public health, and the COVID-19 pandemic has underscored its importance. From using data to help understand the rapidly evolving situation, including emerging variants of concern, to supporting the timely development and communication of public health advice and policy decision-making, epidemiology has played an instrumental role in this response. There's never been more critical time for you to choose the Field Epidemiology Training Program as part of your educational and professional journey. And I, for one, am delighted to see so many new recruits. The Canadian Field Epidemiology Program, which has been active for 46 years, was a founding member of TEPHINET in 1997. Aujourd'hui, the programme continue de contribuer fièrement et régulièrement au réseau. As I reflected on this year's conference theme, this is what we train for: field epidemiologists as first responders to the COVID-19 pandemic. I recall how invaluable the training I undertook in the Canadian Field Epidemiology Program provided me with the fundamental technical building blocks for the work that I am doing now. While my boots are no longer on the ground, field epidemiology training taught me how to work in high stress and complex environments that involve many players. It taught me how to present data and analysis in a way that speaks to decision makers. And it also taught me how to think on my feet, which includes answering questions from the media. My first investigation as a field epidemiologist was to figure out what was causing an outbreak of severe respiratory illness on a cruise ship with over 2,000 international passengers and over 1,000 crew traveling between Canada and New York City. You can imagine what went through my mind when COVID-19 outbreaks began to be reported on cruise ships at the start of the current pandemic. I am proud to be a graduate of the Canadian Field Epidemiology Program, and here's my graduation pin. And I'm very proud to be counted as one of the 19,000 trainees coming out of the TEPHINET programs. There are countless ways that field epidemiologists contribute to protecting the health and safety of people around the world. Field epidemiology training programs provide a common framework and training foundation that lets field epidemiologists from all corners of the globe collaborate effectively and learn from one another, even during urgent public health events. This collaboration strengthens public health systems, builds capacity, and advances health security. À l'échelle mondiale, au cours des 18 derniers mois, les épidémiologistes de terrain ont mis à profit leurs expertises et sont devenus des chefs de file de la réponse à la COVID-19. Worldwide, over the past year and a half, we've seen field epidemiologists applying their expertise and emerging as leaders of the COVID-19 response. During the pandemic, the Public Health Agency of Canada mobilized 66 epidemiologists all over Canada to respond to urgent requests from our partners. The majority of these were current field epidemiology trainees and alumni. At the community, regional, and national level in Canada, Field epidemiologists have been addressing complex and challenging areas of work, applying their core epidemiological skill sets and implementing innovative approaches while they are supporting outbreak investigations, developing new surveillance systems, creating local public health and case management tools adapted to specific needs, and formulating recommendations for public health action. One example where field epidemiologists played a key role was in the repatriations of Canadians at the start of the pandemic through the rapid setup and operation of COVID-19 syndromic surveillance in group quarantine sites. Field epidemiologists in Canada have also supported numerous remote and rural areas in their responses to outbreaks, investigated the impacts of newly emerging variants of concern, and provided epidemiological expertise to our National Emergency Operations Center. I'm sure that you have all had similar experiences in different contexts in your own country. Je suis certain que vous avez tous vécu des expériences semblables dans différents contextes dans vos propres pays. Your experiences in field epidemiology programs will prove to be an exciting journey that will continue well beyond graduation, as these programs provide ongoing learning and mentorship that carries from one cohort to the next. In this way, the lessons learned are passed on through the spirit of continuous improvement that is also embedded in your work. To everyone joining this event, please know that your work has helped to advance the science around COVID-19 and led to the development of evidence-based public health recommendations, which have saved lives and helped to propel the response forward in this challenging time we are facing together. Data are foundational to public health interventions, and I hope that together we can strengthen the public health data ecosystem to standardize, share, and synthesize information in order to address ever-evolving challenges. As part of your core work, field epidemiologists also contribute to advancing health equity by collecting, analyzing, and interpreting data which assess differential impacts of outbreaks across diverse populations. The ability to do this work in partnership and in culturally safe and relevant ways informs policies that strengthen health equity and results in better outcomes for all. I would like to say a sincere thank you to TEPHINET for your dedication to the development of the public health workforce and the advancement of global health security. And a second thank you for organizing this great event and for allowing Canada to participate so fully. To all the participants joining this conference, I encourage you to take advantage of the many experts, trainees, mentors, and other professionals who are here this week. Thank you and enjoy the conference. Merci et bonne conférence.